come just off this what's going on?
Today, Junior.
What's going on today? I think you're putting me off,
Have
mate.
you not had any mushies today, Ninja?
Oh,
What's
my
going
mushy,
on?
I need to go and get on some. G'day guys, Ninja and Jace
Hello.
here. We've got slightly obscure anatomy. Well,
Just for you anyway.
It's
man.
only obscure because I freak out every time I pick up this book.
You don't even open it, do you?
No.
He just looks at the front cover.
Oh, it's just so
This
good.
muscle on the front cover. What are we dealing with, Ninja?
I don't even know the names of them.
It's the erector spinae muscle group, but to be more specific, we're probably going to focus on the most lateral one, which is our ILIOCOSTALIS.
ILIOCOSTALIS.
And what's exciting about this muscle, Ninja?
Well, what I just love looking at it, and you can see all this fascia down the bottom, this white fascia, how it fans out and becomes up in here, so all out in these lateral lines, but it also comes up here and into these ones, but into the spine as well. So you can kind of see these fanny kind of things. So they're all everywhere. But what I'm interested in today is like when you get that pain inside your shoulder blade, so you can kind of see these attachments through here. So what we want to target today is attachments inside Jace's shoulder blade, and then I'm going to try and scoop them down and away because there might be some trauma, some stuckness that's really clogged up, scar tissued up, and we're particularly interested in thoracic rotation.
Yeah, we've actually got video coming out. Stay tuned. 5 exercises to help fix this pain, as well as getting treatment. So stick around for that one. That'll come out.
Yeah. So this is first. So we're gonna clean first, build second, live free is our little.
Free.
Yeah. So we want Jace to live free, or I can live free, depending on who does the exercises.
Oh,
but
who is it going to be?
Yeah. So we're going to concentrate on this here. So get yourself an anatomy book and freak out because it is amazing engineering and design, the human body.
That's
so
it.
and
Right.
Jace is the walking bloody bloody anatomy chart here. So we've got a good model.
Thanks,
So
all right, I'll roll over, will I?
let's do some treatment on you.
All right. There you go, Ninja. Give you a little towel.
Yeah. So what we're going to do is a lot of times we want to warm up these tendons that are inside our hair. Which is going to be better, that one or that one, Leo?
I reckon this one.
This one?
Yeah.
The
Dig into it.
Oh, the light's bloody magnificent here
Oh,
today.
it's good. We've got a good day for it.
Yeah. So we just got a real little bit of wax on the old palm. So that's what we want.
Mrs. Palmer.
Yeah, Mrs. Palmer likes a little bit of wax.
Ooh.
So what I'm doing, I'm hitting Jace's tendons here. So this one can zing up into your head, but it's not really the one we're kind of targeting today, but we want to warm all these up first anyway. So this would be what we would do in a standard treatment here, just to kind of warm up all these tendons just inside.
You got to go through those superficial layers first, don't you, before you can get to the deep ones. You can't go straight in with the elbow. You've got to sort of unravel those lower traps, the rhomboids, and then you can get to those deeper, iliocostalis attachments.
Yeah, true. Correct. Couldn't have said it better myself.
Oh, there's a good one there, though.
So we, the pisiform on your hand. So it's like this little mountain comes off your hand just under here. So on that bit there. So it is a really valuable tool to be able to get used to, because you can really get some power, but some precision into it, and it's very kind of easy on a practitioner's body to be able to use it. But you can see how I'm keeping my arms straight, I'm getting my body weight into it. It's not much exertion. Can't bloody talk. Good thing we don't do bloody speaking English courses, because you wouldn't fare too well.
You don't reckon they'd pass on your...
I reckon they'd all pass, but the bloody students would be better than the teacher. It's not really the way the leader should be, is it? So anyway, I'm kind of getting through this now. I'm really tracing around the border of that scapula. It's a bit cleaner run through here. But a lot of times people do have pain just here, and it kind of can go down into their spine or down their shoulder, different places like that. So just showing where there's pain, dysfunction, that just signifies it. Just relax. So
there
there's
we
a
go, little
there.
spot there.
So what we're going to do, we're going to come just off this. What's going on?
Today, Junior.
What's going on today? I think you're putting me off,
Have you
Jake.
not had any mushies today, Ninge?
Oh, my
What's
mushy,
going on?
Yeah, I need to go and get on some.
Have another go at it, Ninge.
Nah. So what muscle am I? So I'm trying to find a rib. So I'm pushing through all this thick muscle of yours, Jace. And look at that, just in there. So I'm off. I'm not in that traditional spot where you'd see us treating a lot, but we're right into the ribs. And then once I get into that level, I can push down that little bit and I can feel for tendons. So just a little wiggle like that, a wiggle and a jiggle. And yeah, I'm on a tendon there. So I suppose just with years of working like this, you can really feel these subtle changes, these subtle solidifications in the body. So you can kind of tune into that. But even if you're not that experienced, what you can do is just ask, is that the spot?
Yeah.
You know, and like just with a little bit of an arm movement or something, they can really tell, you know, if that has been holding them back from being able to rotate. So think about, we'll talk about it when we do the exercise video, but rotation through our thoracic is such an important, integral movement for the human body, because when we're walking, we're throwing, you know, we're doing all these
Sprinting,
things.
Ninge.
Sprinting is the ultimate way to get this unraveled. But we need to do it. We need to rotate through the thoracic, but a lot of movement that's done in the gym and a lot of stuff that's in today's life isn't using rotation. So we're doing presses and things like that. We're not rotating. We're sitting at our desk. You know, we're working away, we're driving, we're not using any of this rotation. We would have been chopping wood, you know, digging holes, carrying water, you know, climbing trees. We would have been doing all this sort of stuff.
Like you did in your childhood, Ninge.
Yeah, naturally. See, we didn't need a gym. So the gym has been, because of modern, you know, lifestyle and conveniences, we've needed to get in the gym. But yeah, a lot of times we're not using the gym to, you know,
Full effect,
because we're not kind of in alignment with human movement, human engineering, what it needs to be able to, you know, be fully vital and reach its optimal potential. So we've got to be able to throw things, we've got to be able to sprint, we've got to be able to climb, just to do all the things we want to do in our life. So I'm just right on the spot there.
Yeah, it feels like there's one there. If I just shrug up a little bit, you can feel it.
Yeah.
Oh.
So I can really kind of clean into the ribs. I can push out a little bit just to feel for a spot like that. But then I want to just trace down along a line. So we're pushing through the traps. The traps are right up here and around and down. So we want to push right through them, get the light. So push down, and then I can push along that line.
There's a good one there
as well. So, and you can see that the lumbar fascia is a continuation. There's a continuation right from the lumbar, right on the sacrum, the coccyx, right down there, all the way up. So you can work on the lower back as well to help out these little stuck spots right up a lot higher. And you can see from the anatomy as well, it's even the whole way up to the neck, there is continual lines of fascia and muscle that go all the way up. So sometimes you might need to treat right from the base of the skull right down to the coccyx area to kind of clear all these adhesions and stuck spots like that. Yeah, there's a good one under there.
Yeah, I can feel a little flick in there.
Yeah, so I've got to really push through that trap and get it out. Yeah, I can feel there's a spot. I'm bloody doing you a favour here, James.
Yeah, you are. I didn't even know there was one in there.
Yeah, deep down, dark.
Must have been from those 1,000 push-ups I did yesterday.
Yeah, mate.
Not quite.
The card game, mate.
Card game, yeah. How many does that equal, Ninge? What's your maths like? 13 down to 1.
Can't remember. I know 10 down to 1's 55, so add 11, 12 and 13.
Yeah, you lost me. Anyway.
So it's like another 40.
Yeah.
So it might be 95, is it? Something like that.
And then we did burpees as well, so that had a bit of a push element. So, yeah, probably a few little good spots in here.
Yeah. But there, this is kind of what you need when you've got that stuck spot. You're not breathing properly. Yeah, you can't rotate fully when you're doing the exercises that I'm going to show you in the gym. So yeah, you might need some real spot cleaning like that. Anyway.
Oh, feels bloody good.
You can see a bit of redness through the hole there, and especially where I was trying to target down there. So
it's a sign that there's some tight tissue in there and some dysfunction in that tissue is when there's redness that comes up. So if you do get red through your body when you get treated, it's more just that there's blood flow going to those muscles that might have been stagnant or stuck. So it's just a sign that the therapy's working.
Yeah, but recommend that you really work with your practitioner, test it and kind of see exactly where those spots are, and then work on them, and then just sort of see where it leads, because like sometimes you kind of release off one spot, then you realise that something else is stuck as well, but you didn't kind of realise it because the other one was so overwhelming. Can't bloody talk today.
Can't bloody talk.
What's going on?
Yeah, it's just a bit rattled there.
I'm bloody rattled. In your presence, mate. Hopefully
stick around for the follow-up version with the 5 exercises. So hopefully we speak a bit better in that one.
Yep.
Ninja actually doesn't talk, so it actually does get a bit better.
I won't talk.
Thanks, guys.
All right, done.
Get it done.